General examination. In our last video, we talked about history taking of a bedside patient. In this video, we'll talk about general examination. In general examination, we examine a patient from top to bottom. We see about 24 things in a patient, and once again here, the rule is to stand on the right side of the patient. Among 24 things that we see in a patient, the first thing we see on examination is appearance. Means how does a patient appear on looking? He or she can be ill looking, healthy, fatigued, exhausted, apathetic. Second is body build, in which we see if the patient is obese, lean and thin, or malnutrition. Third is cooperation, in which we see how much the patient is cooperative with the doctor's question and answer and their approaches. Fourth, decubitus, where we see the position of the patient, that in which position are they admitted to the hospital or in which position are they lying on their bed. It is a position in which a patient feels comfortable or they don't feel any discomfort. Fifth is intelligence. Here we see the IQ of the patient by asking them some questions related to their disease. A patient intelligence can be below normal, average or above normal. Sixth is nutritional status. We measure the nutritional status of a person by seeing their body weight, body fat and frontotemporal depression, etc. Then comes anemia, jaundice, cyanosis, nail changes like clubbing, koilonychia, leukonychia, dehydration, edema, bony tenderness, and vital signs like blood pressure, heart rate, temperature, respiratory rate. These are some of the most important things that we see during our general examination. Then comes lymph node, thyroid, skin condition, hair distribution, and lastly, jugulovenous pressure. So these are all the 24 things that we see in a patient during our general examination. In this video, we will talk about first 6 points, that is appearance, body build, cooperation, decubitus, intelligence and nutritional status in detail. First is appearance. Here we see the looks of the patient and try to correlate it with the diagnosis. The person's appearance can be normal, ill-looking like fatigue and pain, expressionless face in Parkinson's disease, puffy face in kwashiorkor, edematous face in nephrotic syndrome, bagginess under eye in hypothyroidism, moon face in Cushing syndrome, exophthalmos in hyperthyroidism or Graves' disease, ptosis in Horner syndrome, old man face in marasmus. Second is body build. It is calculated by BMI, which is body mass index. BMI equals to weight in kg by height in meter square. The normal BMI is 18 to 24.9. Overweight is 25 to 29.9, obese is 30 to 34.9, morbid obese is 35 to 39.9, and extremely obese means more than 40. Third is cooperation. Here we see how much a patient is cooperative with the doctor. Sometimes a psychiatric patient can be insane, bipolar. Infant pediatric patient can be non-cooperative, so in that case the history is taken from the parents. In adult unconscious patient, the history is taken from the patient party. Patient party means someone who brings him or her to the hospital. Fourth is decubitus. It is the position in which the patient comes to the hospital or lies on a bed. For example, in a patient with pancreatitis, the patient lies in leaning forward position. As the patient leans forward, the visceral peritoneum gets separated from the parietal peritoneum and pain is relieved. Fifth is intelligence of a patient, which is detected by asking intelligence-based questions or questions related to their disease. The intelligence of a patient can be below normal, which is called moron or imbecile. As you can see on the table below, the levels of intelligence leading to IQ ranges. Lastly, sixth is nutritional status. Here we see the nutritional deficiency of a patient like marasmus, kwashiorkor or malnutrition. It can be seen by frontotemporal joint depression. So that is all about the general examination for this video. The remaining points we will discuss in our next video. Thank you.